Well, thank you very much. And it's a real pleasure to be part of this panel. I feel very pleased to be able to offer a more practice and practical perspective on behalf of other principal social workers, but also adult social care within Islington. And in thinking about social care practice in 2030, I just wanted to take a moment to shine a very bright light on the incredible way that social care has supported the NHS, communities and individuals during the critical period of the COVID pandemic. And as ever, there have been huge difficulties and huge challenges, but also a great deal of learning. And I'm really passionate about the fact that we need to take this learning forward into whatever our new normal will be, and that we shouldn't just automatically go back to how things were. So I wanted to just start by thinking about what we've done during the critical COVID period within adult social care and what we've learnt as a result. And one thing that's been really hugely important is flexibility. And adult social care has absolutely shown that it is able to be extremely flexible in the redeployment of staff and changing services, changing ways of working, integrating different teams and pathways. And that's obviously been of huge benefit to individuals in the community, the NHS, but it's also been great for our workforce as well. It's given people the opportunity to learn new skills, have new experiences, and have personalised ways of working. There's also been a huge emphasis on community, and we've talked about the importance and the value of community strengths and assets for a long time, but it has come into real sharp relief over the last few months, and the importance of reaching out to the most vulnerable people within our communities, making sure that our support is preventative, not just reactive, and also working very closely with many different community organisations, many individuals within our communities to find the right solutions and the best solutions, and the rich contribution that we have had from volunteers, residents, families and friends. And it really truly has shown what a tremendous impact this can have on the support that can be offered to people. Technology has really come into its own, hasn't it, and has shown huge benefits. And we need to take this forward. We need to really make sure that we don't fear technology, but that we actually embrace it. We learn about it. It's all around us, that we make the absolute most of it, because it's been a steep learning curve, I think, for individuals, residents, social workers, managers, all of us. And huge progress has been made, and we really must not lose that. I think what this has also brought about for individual social workers and other professionals and practitioners within adult social care is heightened autonomy, heightened independence in the way that people have been working. As for many of us, people have been working in a much more isolated way, on their own, at home. But actually, this has really enabled staff to come into their own in terms of their own leadership, their own professional judgment, improving their understanding of how other colleagues, other teams, other services work. And the feedback has been that staff have really enjoyed this aspect of how they've needed to work. It's built their confidence, it's built up a sense of value, increased creativity, more rapid decision making. And I think this is really important also to maintain as we go into the future, because this will then link with increased enjoyment of one's work, a link with recruitment, retention, and also increasing our skills and our knowledge and career progression. Staff wellbeing has also been clearly an extremely important aspect of how we actually manage to continue providing the services needed within this very, very difficult period. And there's been a huge focus on making sure that carers are cared for. There is this continuum of humanity that includes all of us. And just because we are professional social workers, professional nurses or occupational therapists, we are also human beings, and we've all been going through this extremely difficult and challenging times in very, very different ways. So we need to make sure that we care about our staff, we care about the people who are doing the professional caring. And again, this has been hugely acknowledged and appreciated by frontline staff. And in fact, something that's come through quite clearly is that frontline staff feel that they have been worked with and managed and collaborated with in a much more compassionate and empathic way by all of their peers, colleagues and managers. And again, this really does need to continue as we move into the future. None of this would have also worked without the huge amount of joint working that's gone on, and I'm sure that all of these things are recognised by many of you in your own adult social care departments and teams and services. There's been a huge need to work together quickly for the greater good, focusing on what the impact will be and what the results will be. And this has really broken down many barriers between different organisations, different departments, different services. It's accelerated essential partnership working, and this will all really support ongoing culture change, which needs to focus on promoting people's strengths and independence. So looking ahead to 2030, or looking ahead to the future, we need to make sure that we bring all of this experience, all of this learning along with us into the future. We need to bottle it so that we can take it forward and it can really shape the way that we move into a new way of providing adult social care in the future. We need to maintain the focus on community-based and community-led support. We need to make sure that we're focusing in the right areas, and that will be some critical services. It will also be prevention and early intervention. We must not lose the progress that we've made in terms of putting technology on the table and in the centre of everything, because it really will be a key enabler in supporting staff to work in a wide variety of different ways, both virtual and remote and face-to-face. It will also be a key enabler in supporting people to be able to lead the good lives, the better lives within their communities and within their own homes. And we also need to make sure that we are addressing all of the inequalities that, again, we've known about, but have come much sharper into focus over the last 2 to 3 months. And I think that has to be addressed in a much more explicit and proactive way. And finally, we need to make sure that the excellent collaboration and co-production needs to continue. That's working with people, with friends, families and carers, professionals, and also local communities. And we need to make sure that we can harness all the resources that those things will bring. And the ultimate aim will be to support people to live in their own homes, and also implementing a much more strength-based approach with choice, control and independence. And I would just like to end by saying that the essential enablers, well, I think most of those are contained within the newly published Shaping a Better Future and the 9 statements. And it's about parity of esteem, making sure that adult social care is valued alongside health services, housing, and other partner organisations as well. Making sure that that funding is formalised and put on a longer term footing, and that there is continued greater public awareness and public value for adult social care. Thank you.